Welcome to Stream of Conscience, brought to you by Democracy for America, Fairfield County. I'm your host, John Hartwell. And joining me today is my co-host, Kate Tepper, Chair of Democracy for America in Fairfield County. Our guest today is Leslie Blatteau, President of NARAL Pro-Choice Connecticut, the leading political voice for women's health. Leslie and I serve together on the board of NARAL, and I'm also on the board of the Reproductive Health and Rights Foundation of Connecticut, a sister organization of NARAL. Leslie, welcome to Stream of Conscience.
Thank you. It's great to be here.
So how did you get involved in NARAL and in women's rights issues in general?
Well, specifically how I got involved with NARAL is a pretty funny story. It was 2005 when former President Bush was making many recommendations for Supreme Court justices to the Supreme Court.
Right.
And it was really freaking me out. I was watching from the sidelines, reading internet posts, reading the newspaper, and realizing this is what they talk about when a president can really leave a legacy, and I wanted to do something about it. So sure enough, NARAL Pro-Choice America had online organizing tools that I wish I could remember how I got linked to them, but somehow I did. And they had a petition contest for the Stop John Roberts campaign. It was Choose Justice, Stop John Roberts. We all know now, as we look to who the Supreme Court Justice, Chief Justice is, that we didn't necessarily achieve our goals there. But I downloaded and printed out the petitions, and at that time I was the singer in a punk band. So we played punk rock shows all summer, and I brought my clipboard with me and collected signatures. I had a song specifically, You Can't Say, about the gag rule. So before I launched into You Can't Say, I talked about the petition, sent it around, talked about the danger of stacking the Supreme Court, and collected a lot of signatures. I wasn't in it to win it. I was in it to stop John Roberts. And then I guess maybe mid-September, I got a phone call, 202 area code, and wondering who it was. Right. And turns out I had won the petition contest.
Nationwide?
Nationwide petition contest. So they are calling to inform me that I had won, and I was going to get an all-expense paid trip to Washington, D.C., to tour the NARAL Pro-Choice America offices, to have lunch with Nancy Keenan, and to celebrate the work that I had done. So that was the beginning of my, celebrity enjoyment of the work, and it really connected me more to the day-to-day work that can happen.
So the first learning from that is that we should have more punk band rock singers circulating petitions that you can actually get a lot of work done.
It absolutely works. I mean, a couple years ago, for a NARAL Pro-Choice Connecticut event, I partnered with Kathleen Hanna and did a photo shoot with her, and she is a heroine of mine as an outspoken pro-choice activist and performer. So you're right, John. Performance, art, and politics go well together.
But as does regular activism.
Yes,
yes. I've been involved in the women's movement for a little longer. I'm a little older, and mine was Reagan and gag rules. How dare you tell somebody that they can't have an abortion? It is absolutely legal. Mm-hmm. And I did the petition thing. Mostly I'd do it on outside post offices, and a surprising number of people would sign this, which indicated to me that there was not the antagonism towards this that we were being told in the mainstream media. So I'd like to ask you, when you were doing these petitions, how much you focus on looking at the language that the anti-abortionists use, and how involved they don't understand that Planned Parenthood and women's clinics don't just do abortions. They do abortions 2 days a week, usually, but they also do mammograms, they do pap smears, they take care of women's health, so they do have healthy children. Mm-hmm. So there's another side to look at that.
I think that's such an important part of the movement as a whole, that while of course, first and foremost, we're working to make sure that Roe v. Wade remains Roe v. Wade, but right along with that is that women can access birth control, not just birth control, but affordable, if not free, and we can talk about that a little later,
yes, right.
Free birth control, because if women are going to be equal participants in this democracy, which is a theme of the show, I think, then we have to decide when and if we have children. So I think the audience that I was speaking to as I was collecting signatures were absolutely in support of that, knowing that to have a seat at the table, women need to be in control. And I think one of the things John Roberts said, maybe it was a quote in an interview or something he wrote, but he referred to equality as pernicious.
Yes.
And that was particularly offensive to me because it's, I see it, not only am I an activist and on the board of NARAL, I'm also a history teacher. So I see equality as one of the foundations of this country. So to refer to it as pernicious is pernicious.
So Kate mentioned Planned Parenthood a moment ago, and you're with NARAL, and many people may not know what the differences are. Can you just give us a brief summary of what NARAL does as opposed to what Planned Parenthood does?
So NARAL is the C4 organization that I'm a part of is strictly the political advocacy and organizing arm of the pro-choice movement. Planned Parenthood are the service providers, and we are the sort of the frontline defenders of the work that Planned Parenthood and other women's clinics and health clinics provide.
So Planned Parenthood has clinics. They employ doctors and nurses and other healthcare professionals, and they're spread out around, and they provide abortions. They provide, as Kate mentioned a moment ago, a wide variety of other health services for women. NARAL does not have any clinics.
No, we are not a service provider at all.
Not a service provider. It has nothing retail. It's really a political organization that's there to make sure that women's rights are maintained at the political level. So NARAL Pro-Choice Connecticut is different from NARAL Pro-Choice America. What's the difference here?
So NARAL Pro-Choice America I see as the umbrella organization or the mother organization of what we call affiliates throughout the country. And I'm not sure, but I'm guessing around 30, you might know better, John, around 30 affiliates. Not every state has one, but there's a New York, Massachusetts, New Mexico, but we're the affiliate here in Connecticut that works specifically in Connecticut with Connecticut voters to support and maintain the pro-choice constituency here in the state.
How much work does NARAL do, not just statewide, but as a countrywide organization, to work with other organizations? Because I was also the president of now many years ago in Fairfield County, and we did work with NARAL, but our aims were pretty much the same, which was women's equality, and that included, of course, our right to have abortions if we wanted to have them. So do you work strongly with other organizations?
Oh, absolutely.
Yeah.
We're part of a coalition here in Connecticut, the Coalition for Choice, where we partner with Planned Parenthood, with the ACLU, with religious groups that support choice as well. So obviously, since we have the same goals, which are what you just said, Kate. We are happy to work as a coalition, and then we like to use that work as a coalition and then kind of branch off from there and work on specific projects, depending on what the need is and depending on what the different members of the organization are saying is important at that time. But I know, for example, we just had a lobby day down in Washington, D.C.
I noticed you're wearing the T-shirt.
Yes. If you stop the war on women, we'll stop coming to your office. So we went down in April and we partnered with Planned Parenthood and the ACLU and filled a bus to go down from Connecticut to D.C. Right. So on events like that, numbers are very important.
Oh, yeah.
So we want as many as possible. And then we come back here and do the day-to-day work as NARAL Pro-Choice Connecticut.
So one quick other organizational question. NARAL actually has 3 different pieces in the state. Could you briefly tell us what they are?
Yeah, the C3 is the Reproductive Health Foundation, pardon me, correct me, because I know we've changed the name.
Reproductive Health and Rights Foundation
Thank you.
Connecticut.
John, as the board member, knows that.
But a C3 is a foundation. So the money that people give to the C3 is in fact tax deductible.
Yes, the C4 is a nonprofit, but a political nonprofit. The C3 is, as a foundation, more about education and outreach. So any donations to the C3 are absolutely tax deductible.
So can you explain very clearly so that if somebody wants to donate because they see this program, that they donate to the one, if they would donate if it's tax deductible and they feel a little bit different if it's not tax deductible, where should they go?
If they really want the tax deduction, if they're making very large donations,
Yes.
we're happy to take it into the C3. If they are so committed to the cause, as we are here,
Yes.
and want to donate regardless of the tax deduction, then we absolutely would appreciate it in the C4, because we are doing the front lines work to make sure that women have access to clinics. We're doing the front lines work to make sure that the right or the anti-choice folks aren't trying to pass laws preventing access. They're always trying to sneak them in. So those kinds of things around access is the work of the C4 when it comes to being up at the Capitol and working with legislators.
And then in the election season, there is the PAC.
Right. The PAC sort of comes alive each election season and does a survey of candidates and decides who they want to endorse as a 100% pro-choice candidate. There's no middle ground. You're either 100% with us or you're not pro-choice enough for us. So it may sound a little harsh, but when it comes to these slippery slopes, we have to be very, very aware and protective of the rights. One of our board members is always saying, it's a slippery slope. They're chipping away at it. And it's really, I think, a brilliant organizing technique of the anti-choicers that they're going to take whatever they can get and slowly chip away, whether it be a 48-hour waiting period, whether it be increasing the age, lowering the age so that 16-year-olds have to get parent permission. These little things are really fundamentally changing Roe v. Wade and stripping away women's rights.
So let's talk about the state of women's health rights in Connecticut, because we start off, I believe, with a very strong position.
Oh, absolutely. We are in great shape here in Connecticut, relatively speaking. NARAL Pro-Choice America, one of the things that it does each year is grades each state. So Connecticut every year comes out with an A, which we're very proud of. So it puts us in a good position as far as health rights are concerned. Sometimes it makes it a little hard to organize people, and it's one of the things that I really wanted to talk about today is saying, you're sitting out here as an audience member in Connecticut and you're thinking, oh, see, Connecticut's fine. Why don't I put my time, energy, money into another cause that needs me? Whereas I would argue we have to do everything we can to maintain the A, to be the standard for the rest of the country, so that when our sisters, especially in states like Ohio, South Dakota, Virginia, are really struggling, they can look to Connecticut and say, Connecticut is the standard we want to reach.
So, for example, the provisions of Roe v. Wade, the constitutional decision by the Supreme Court in 1973, when women could absolutely have abortions, that's already been written into the law here in Connecticut as well. So, in fact, we in the Connecticut don't depend on a Supreme Court decision to have abortions legal in the first trimester. But I'm sure there are other things that are under the gun up in Hartford. You mentioned before that the anti-choice forces are always trying to slip things into the legislation. So what are some of the things that we've fought against in the last couple of years?
Every year we're concerned about parental notification, and while this past year they didn't manage to get it in, they're working already behind the scenes and preparing to launch an attack on teenagers' rights here in Connecticut. While of course organizations like NARAL Pro-Choice Connecticut and Planned Parenthood support and encourage teenagers to communicate with their parents. We believe, obviously, that's a decision that teenagers should include their parents on. The law exists for the few who can't communicate with their parents. And when I think about it, our laws do exist for the few who aren't protected. So when people say, sometimes it hits a little close to home, that parental notification or parental permission law, especially parents of teenage girls, and they say, oh, I'm not sure. I worry what, the line is, oh, you need parent permission to get your ears pierced. But it's really something completely different we're talking about. And if a teenager is being abused or raped in the home, or if a teenager is a foster parent, she's going to have to go through many hoops to get permission from parents, or can't even speak to her parents about it, and then going to see a judge, and further prolonging accessing an early abortion, which is much safer. So we believe that if our fight against any parental notification law, it really is to protect those individual young women who need the protection. And again, we support communication between teenagers and parents. It's not that we're trying to undermine that relationship by any means.
One of the things that isn't happening, I think, is that there is a way to prevent abortions, and it seems to me that the forces that be that are doing all these things against abortion, cutting it, is that they're against contraception, and so gradually the laws are saying that we cannot have this and we cannot have that, and because it's an anti-abortifant, and it's not. You know, the RU 586 is, but the
morning after pill,
the Plan B is not,
Mm-hmm.
and so there's a lot of mass misinformation.
Oh, I think you're absolutely right.
And that I am sure that NARAL is doing a lot. I mean, I see some of the stuff, but when we talk about things, language is very, very important, as we discussed before the show, and I think that those things need to be brought front and center, because if we can prevent it, then we certainly are not going to have to go through the hoops that we go through after conception's occurred.
I think it's a great point. The misinformation piece, I think, is really huge. That the anti-choice side is able to redefine what birth control is really very disturbing. Yeah. And when they start pointing out that an IUD is actually an abortion, or that the morning after pill, emergency contraception, is actually an abortion, they're lying to people in the United States, and they're going against science, which we know they have a history of that, unfortunately. But sorry, I lost my train of thought, but I'll bring it back. That, you know, we want to enable women and men and families and single people to decide when and if they have a child. And that obviously, as you point out, comes back to them being able to access birth control when they want it. Recently, when the Health and Human Services Secretary made the recommendation that birth control should be at no cost for people who are insured, that was great reason to celebrate. It's something that probably should have been decided and recommended decades ago. Sure. However, we'll take it when we can get it. And some of the things that I was hearing from the other side, that, women could get birth control if they wanted it. Most of them are drunk when they're having sex anyway. Mm-hmm. These really sexist, misogynist things.
And a lot of them coming from women as well. On the major news networks, it just was stunning to see some of the things that people say.
Yeah, just saying, this is a morality issue for our young girls. We should be teaching them to value their bodies. I think teaching people of all ages about anatomy, about ways to prevent pregnancy, is the utmost respect and reverence for the body, because you're truly understanding what it's doing and how it works. In a job that I used to do before I became a teacher, I worked with teen parents in a New Haven public school system. And we realized really the lack of information that was there. So some girls became pregnant and really didn't realize the amount of access that they had to different birth control that was relatively easy to get once they navigated the system to figure out how to get it. So it's really, it's an information challenge that we have to make sure that this information is getting to the people who need it.
One of the things that concerns me also is that if you have insurance, you can get the birth control free, but there are millions of women who have no insurance. They don't have enough money to put food on the table. So they're going to choose to put the food on the table rather than the birth control. But, sex still happens,
right.
And it's still
That's human nature.
So then there needs to be some kind of focus on the people who really need it. These are the people who really need birth control. Mm-hmm. And I don't see much being done about those people who cannot afford it.
Well, again, Connecticut receives its A rating because women on Medicaid can access the full range of reproductive health services. And it's, again, one of the reasons why Connecticut scores so well. Yeah. And we are really grateful in Connecticut that low-income women aren't hindered by that. They're able to use Medicaid and get the services that they need or want. So that's a good thing. But nationwide, it becomes scarier and scarier. Another reason why Connecticut is really in good shape is the amount of abortion providers that we have in our state relative to the amount of counties that we have. 92% of our counties here in Connecticut have abortion providers, mm-hmm. whereas other states, it's, women have to travel a day or more, and then an added waiting period to that. It's really some frightening restrictions on something that already is safe and legal.
Yeah. Now, Kate, you used to be a clinic escort
Yeah,
at
I was
one of those
was-
clinics in Bridgeport.
Yeah, I was a clinic escort at the Summit Women's Centre in Bridgeport for about 4 years. So I would go twice a week in freezing cold, be there at 6 o'clock in the morning, and already the anti-choice people would be lined up there. And they would have pictures of dismembered, rather ancient fetuses. Actually, some of them would really be babies and they would have horrible pictures. They put them in front of the women who are already upset because they're having to do this. Isn't something that anybody wants to do. So they would be upset when they go in to have the surgery, and this means that they don't heal as well. There would be very few men escorting these women. It was a storefront. And then they would occasionally, maybe every 3 months, they'd bus in a whole load of people. And so I would have a sign that said, 75% of men are against abortion, 100% of them will never be pregnant. Those kinds of things. So it was an experience that makes you throw up before you go in the morning, because it's really nasty.
And it's something that I wish, again, that we could find common ground with the people who are opposed to abortion and increase access to birth control and contraception. But it's really where we feel like we don't feel like our hands are tied, because we're working hard and we're doing everything that we can, but we feel mystified that here's an opportunity to lower abortion, and we say it over and over, but yet they want nothing to do with it. So really you have to take a few steps back and wonder, what are the motives? And it's, we were chatting about this before the cameras went on, but are they trying to bring us back to the Middle Ages?
They are. Actually, we had more freedom in the Middle Ages as far as this is concerned.
So Leslie, in terms of what people can do here locally, if they're interested in this issue, what should they do? I mean, we've got NARAL, we've got Planned Parenthood, we've got other organizations around. Where should they be spending their time, and how?
So I think they should definitely sign up with the action lists that exist. There's NARAL Pro-Choice Connecticut, the Choice Action Network, which is an easy way to sign up, and you get email alerts for when important things are happening. Planned Parenthood Votes Connecticut has a similar setup. So it's, so much of our organizing these days is done on the web, so take advantage of that and find out when things are happening. In addition, we like to promote the social community that comes with the pro-choice movement. So be on the lookout for different social events that are happening that bring pro-choice people together. In addition, we are going to work on having movie screenings, potentially at college campuses. NARAL Pro-Choice America has, in partnership with HBO, is showing a movie, 12th in Delaware, which is a very interesting piece. It's a corner in Baltimore where one side is a women's health clinic and the other side is a crisis pregnancy center.
We haven't talked about those at all.
We haven't even hit on it, but it's huge. In fact, if people want to get involved, go find out through NARAL Pro-Choice America what a crisis pregnancy center is, and be on the lookout when you see them. I know in Hartford there's one directly across from a women's health clinic, and these organizations are, again, providing misinformation to women, lying to women, and we need to work more actively on making sure that people can access the information that they need.
Well, this has been terrific. Thank you very much for coming in today.
Oh, thanks for having me. I love talking about it, especially with people like both of you.
Well, and Kate, thank you again for coming in and helping out
You're
today. Leslie, keep in touch. We want to see what's going on. Come back and talk to us as the year goes on.
Excellent. Thanks. I will.
Thank you.
The debate over whether abortion should be a legal option for women with an unwanted pregnancy continues to divide Americans long after the U.S. Supreme Court's 1973 decision in Roe v. Wade. That decision declared that abortion in the first trimester of pregnancy was a fundamental right. Even though they may be personally opposed, most Democrats endorse a woman's right to choose. The Republican ideology adamantly opposes abortion. With the recent spate of anti-abortion laws passed at both state and federal levels that deny women the means to protect their health and plan their families, Roe v. Wade is suffering from death by 1,000 cuts. More than 900 anti-abortion laws have been introduced since the midterm elections, and more than 60 have been passed. Anti-choice legislators are busy enacting punitive laws that increase the costs for family planning clinics, forcing them to close down. Efforts to defund Planned Parenthood are clearly part of a larger campaign to deny women access to proper health care. According to the Guttamacher Institute, a sexual and reproductive health research and policy group, every dollar spent on family planning saves the government $4 in costs for low-income women. The move to defund Planned Parenthood, the only health care resource for many poor women, is both fiscally irresponsible and counterproductive. Women who need gynecological, family planning, or abortion services continue to be confronted by screaming protesters, vandalism, physical attacks, and verbal abuse. There is a war of terror on abortion providers and staff. Clinics have been bombed, and doctors who provide abortion services have been murdered by anti-choice fanatics. As a clinic escort who helped women run the gauntlet of these anti-abortion activists at the Summit Women's Clinic in Bridgeport, I can attest to the ugliness and lack of compassion displayed by these fanatics. From my experience, sad to say, once the umbilical cord is cut, those same righteous advocates for the unborn rapidly lose their interest in the already born child or its mother. I remember on one particular day, a very young girl was brought to the clinic for an abortion, a child having a child. The anti-choice gang showed no mercy as this terrified girl was taken to the clinic. So much for caring and compassion about human life. Connecticut was the first state to criminalize abortions in 1826, but in 1993 it was also the first state to enshrine Roe versus Wade protection into state law. So access to abortion doesn't depend on the Supreme Court in Connecticut. What is at risk, however, is the threat of more restrictions like those recently enacted in other states, specifically more rules around parental notification. Anti-choice organizations like the Family Institute of Connecticut are active and determined, and we in the progressive community must be just as determined. It's time to stop using women's reproductive health as a political football or a punching bag for an extremist ideology. Protecting a woman's right to choose and control her body and her health is as important and urgent today as it has ever been. This has been a Stream of Conscience commentary. I'm Kate Tepper. Thank you for watching.
That's our show for this week. We hope you enjoyed it. If you live in the town served by Cablevision from Norwalk, you can catch the show every Wednesday at 8 p.m. on Channel 88. If you're interested in learning more about progressive political action in Fairfield County, please check out our Democracy for America group. We meet the first Wednesday of the month, 7 to 9 p.m. at the Silver Star Diner in Norwalk. We always welcome new members. Remember, change is possible, and you can make it happen. This has been Stream of Conscience, and I'm your host, John Hartwell. We hope to see you again soon.